Oklahoma.
First, I'd like to say thank you for presiding. You drew the unlucky number tonight, and I appreciate it. We're embarking on a process that is going to start tomorrow night, and people are going to cast a vote on a bill they haven't read and saying we ought to go on with it. Just a little history, 97.8% of the time in the U.S. Senate that a bill passes on a cloture motion to proceed to the bill becomes law. It's an interesting statistic, especially when we're going to hear those that say they just want to have the debate. The fact is that isn't what's going to happen. As one of the two practicing physicians in the Senate, I thought I'd speak what I see is wrong with our healthcare system, as well as talk about what I see is good about our healthcare system, and then talk about the approach that this bill, my staff has now been through the vast majority of this bill. I personally have not, but I will, and talk about how it affects us. What's the real problem in healthcare today? What's the thing that keeps people from getting care? The number one thing that keeps people from getting care is cost. It costs too much. And fully either a fourth to a third of every dollar we spend on health care doesn't help anybody get well and doesn't prevent anybody from getting sick. There's an interesting study out by the Thomas Reuters report that says 600 to 850 billion, that's B with a billion, dollars, is wasted annually in all American health care. And when you break it down, it's broken down like this. 40% is healthcare waste, unwarranted treatment, overuse of antibiotics, use of diagnostic lab tests to protect against malpractice exposure. That accounts for 250 to 325 billion in annual healthcare spending. It's attributed to extra tests and procedures generated mainly from defensive medicine or Medicare's fee-for-service system. The second biggest factor out of this 800 billion that we're wasting is healthcare fraud. It's 19% of healthcare waste. At least $125 to $175 billion a year. And most of that is in government-run healthcare programs, not the private. Private sector has less than 1% fraud. They also have a denial rate that is half to a third of what Medicare's rate in terms of denial of payment claims. The third most important thing in terms of waste is administrative inefficiency. The large redundant volume of paperwork in the U.S. healthcare system accounts for 100 billion to 150 billion in spending annually. The fourth most important error is 12% of healthcare waste. It's health provider errors. Errors we make that cause, me as a doctor or a hospital makes, that cause us to spend money that we shouldn't have to spend. 6% of the healthcare waste is preventable conditions, like somebody with diabetes getting their blood sugar out of control and end up being hospitalized when, in fact, if they'd had really good care, coordinated care, it would have never happened. And then, of course, number 6 is 6% of healthcare waste, and that's lack of coordinated care, where we don't coordinate the care, where doctors don't talk to one another, doctors don't talk to the hospital, doctors don't get all the information, and so consequently, we waste money. So the first problem that plagues us is that cost is too high. And we fully know that one out of every $3 we spend in health care isn't helping health care. So that's our pot of gold. That's where we lower the cost. Just think what health care would cost if it cost a third less today. Or if it costs the same for the next 5 years, that means we could cover everybody that's not covered for free and have about $400 billion left over. If we just went after where the pot of gold is. The second problem with our healthcare system is we have disconnected the purchase of healthcare from the payment of healthcare. So that when I go to make a purchase, I no longer use the discrimination that I use in everything else that I purchase about seeing if it's of value to me. I don't ask what it costs. I don't ask if it's the best way to get there, if it's the most economical way to get there. I don't question to make sure, are you sure I have to have this done? I don't necessarily get a second opinion. And I don't ask if it's got to be done, where's the best place as far as efficiency and dollars to get it done? And the reason we don't ask those questions is because most of the time the money isn't coming out of our pocket, because we have this perceived false belief that our insurance company or the government's paying for it. Well, if your insurance company's paying for it, you're paying for it, because for every 3.5% cost of your company is paying for insurance, 2% of that would have been your wages. And for every dollar that we spend in Medicare, your grandchildren and your children are paying into that fund to pay for your Medicare. So in fact, it does cost it, but we've disconnected that cost. The third thing we've done is we have a tax code that says if you're fortunate enough to have your employer pay for your health care benefits, you get $2,700 more in tax benefit than everybody who doesn't have their employer paying for their insurance. You get about $100 in tax benefit if you don't get your insurance through your employer. So we have a 27-fold discrimination that advantages those whose employer pays for their health care versus those who have to buy it on their own or their employer doesn't offer it. That's wrong. It's not fair, it's unequal treatment, and it creates this maldistribution in terms of the cost plan. But even having said that, the cost for an individual plan versus a plan with the bought through your employer, if you buy it on a nationwide marketplace, if you could, would be 20% less than what you could buy it through your employer. Those are the real statistics. And then the fourth thing that I see that's wrong as both a patient, and I ought to stop here in a minute and tell everybody, at 61, almost 62 years of age, I'm a 2-time cancer survivor. I've had malignant melanoma, and I've had metastatic colon cancer. I also have atrial fibrillation. So I mean, I have been a patient. I've been on the other side of my stethoscope as a patient. And what I see is we have limited the options for people in this country. If your employer buys your health insurance, you have very limited options. You get to take it or leave it most of the time. Here's what we're providing. You get to take it. But if you don't take it, then you got to go outside and you lose that $2,700 advantage. And so it comes out of your pocket. So we don't have the freedom to choose within our employer. We also have the states. We heard the senator from Maine talking about the really increased costs in Maine. Well, there's a real big reason why Maine has the massive inflation in their health care insurance, is they created a state plan that caused it, that truly limited the competition. And so they've seen the results of limited competition because of what they installed. But we have every state has an insurance commission that both decides who's eligible to sell in the state, but also follows the mandates. Here's what the minimum is you have to buy in your state. And then, of course, if you have Medicaid, you have limited options because 40% of the physicians in this country won't see you. And if you have Medicare, you have limited options because now about 15% of the physicians, fast rising to 30 or 40% of the physicians in this country, aren't going to see you. And then if you have VA, you get VA, and that's it. You don't get it. You don't get to choose your doctor, or you don't even get to choose your location. Here's where you will be, no matter how many miles it is, and here's the doctor you will see. And the same thing with TRICARE, essentially, because TRICARE has limited coverage in terms of availability of all the physicians. The fifth thing that I see that is wrong is there's an absolute lack of transparency as to what something costs and what you can expect as far as quality outcome. that makes it hard to know how to buy, where to buy it, or who to buy it from. Who do you trust? So if there's no transparency in either quality or price, you're going to have a tough time making a decision. And so it becomes back to trial. All these things I'm describing describe a lack of liberty, a lack of freedom. We have government mandates. Have you ever gone to a hospital? It's a great question. One of my constituents wrote in and told me this, and I'd never thought about it. Go to a hospital in the middle of the day and try to get a parking spot. And then go to a hospital at 10 o'clock at night. And the parking lot is almost empty. What you're seeing in the difference in the parking lot is the administrative bureaucratic overhead that is required in the hospital to manage the mandates that the government has put or the insurance company has put on the hospital. And if you look at it, fully a third of the people in every hospital in this country don't do anything to help anybody get well. They're filling out, they're pushing the paper, much like this study that I referenced from Thomson Reuters. Then we have insurance mandates. What's wrong? If in fact you have a pre-existing illness, you don't get insured. That's wrong. We need to fix that. Or if you get sick, insurance companies have figured out a way to drop you. That can't be right. I mean, that's why you bought insurance in the first place. And that's not just in the health insurance industry. Try filing a claim for a new roof on your house and see what your insurance costs do the next year, or if they'll really reinsure you. In Oklahoma, we have hail all the time and we get roof damage. And a lot of times, if you've had that 2 out of 10 years, they won't even reinsure you. So you have to go and find somebody else. It's a practice of risk management that they're using that doesn't think about the potential market of who their customer is. So I agree that we ought to fix those things. Then we have the cost. We heard the senator from North Dakota tonight talking about drug prices. The one thing he didn't tell everybody is that the reason that drugs are cheaper in Canada is because they threaten not to honor intellectual property of this country. And there's a real good way to make sure drug prices go down. And that's for both the Bush administration failed on this, the Clinton administration failed on this, and this administration. If Canada wants to tell our drug companies what price they'll pay, then we'll tell them what we'll pay for their lumber. And we'll tell them what we'll pay for anything else they want to import in our country. But we can't, we put all the focus on the drug companies instead. And so I'm going to get to my point. The other thing that's wrong is that on average it costs $1 billion a new drug just to go through the FDA process in this country, because we have such a litigious society and such a aversion that it costs 2 to 3 times to prove a drug in this country than it does anywhere else in the world. We have drugs that are fantastic drugs that are made by companies in this country that aren't allowed to be sold in this country, that have passed all the safety and efficacies of the European Common Market, but they can't get them through our Food and Drug Administration. Because the Food and Drug Administration is worried about somebody criticizing if they ever make a mistake. They're worried about what's called a Vioxx effect. Is met the standards, they did it right, they recalled it. Now they're afraid to prove anything because they're afraid somebody will be critical of them. Another thing that's wrong is we have the lack of any real market forces. Insurance companies really don't have to compete. They really don't have to compete. And the government sets the price for everything essentially, because Medicare says what they'll pay, and everything else is priced off that. Here's another thing that's wrong with our healthcare system. We're starting to experience it. There's a maldistribution of physicians in this country, both in terms of geographic location and physician specialty. 1 in 50 graduates of med schools last year went into primary care. Just 1 in 50. Everybody else went into specialty and subspecialty residencies. Why did that happen? Why? The reason it happened is because the earning power of somebody that has 7 years of medical training is 1/3 of somebody that has 8 or 8.5 or 9. How'd that happen? Because Medicare set the payment rates. Medicare set the payment rates, so they created a maldistribution in terms of the payment for physicians. Another thing I noticed as a practicing physician and also as a patient is that our whole system right now has its emphasis on sick care, not preventing disease, not on prevention, not on the maintenance of chronic disease, but we wait till people get sick and then treat them. That's really expensive. And the reason, again, I'm going to tell you the reason it's that way is because Medicare won't pay for prevention. They refuse to pay for prevention. If you sit down with a patient in your office, a Medicare patient, and spend the time to go through the risk factors and go through the lifestyle changes and go through their medicines and go through the things that they need to do, you will not be compensated enough to pay the electricity bill for that office visit. So what has happened is we've incentivized people not to spend the time with the patients. We've incentivized them to see more patients for a shorter period of time and not listen to the patient and not spend the time on prevention because our dollars have been incentivized against it. And then finally, the government systems are designed to be defrauded. If you think about it, it's easy to make $500,000 a month off Medicare. And it's hard to get caught. And all you got to do is know a whole lot about medicine, have a little bit of guts, and set up a vacant office somewhere and put one computer in it and run everything over the line, and you can rip off Medicare like crazy. As a matter of fact, we know the drug dealers in Florida are starting to shift away from drugs and into Medicare fraud because it's easier to do, they can make more money, it's harder to get caught, and when you do get caught, the penalties are much less. It's designed to be defrauded, but we haven't changed that. So I've talked about the problems. Let me talk to you about what's great about American healthcare. Because I want to make the point in a minute that the worst thing we can do in trying to fix what's wrong is destroy what's right. We have the greatest acute care any place in the world. If you get sick, there is no better place in the world to get sick than in the United States of America. And I don't care where you are. The statistics bear that out. There is no question. If you get cancer in this country, you have a 50% greater likelihood of being alive 5 years from now than anywhere else in the world. And it really doesn't matter what type of cancers. There's some differences on some. But overall, you're 50% more likely to be alive. The third thing that's great about our country is innovation in healthcare. Is 2/3 of the world, actually last year was 74%, of all innovations in healthcare come out of this economy. We have invested in the research. We have the scientists. We have the researchers that have pulled together technology, thought, experience, and research and come up with great innovations that make big differences in life expectancy and quality. The other thing is we have a very skilled workforce. We have some shortages. Our nursing shortage has been totally created by the government because we created a healthcare system that has both hospice care and home health care, but we made the only way that that can be effectively work is through registered nurses. So we sucked all the registered nurses out of the hospital because the time constraints and the lack of holiday work and the lack of shift work, the best nurses want to go where they don't have any of those things. So we created a shortage when we could have created a different class of somebody doing home health care rather than an RN. But that's what we've done. So we've created this sucking sound, as Ross Perot used to say, and we've sucked the nurses out of the hospitals. And now we're on this critical shortage of nurses in our country because of what we did, the government did. The other thing, besides the skilled workforce, the nurse practitioners, the PAs, the nurses, the physical therapists, the pharmacists, the radiology techs, the doctors, the surgical nurses, they're great in this country. They're great. And then we have great medicines. Great medicines. I mean, if you think about the combination of medicines that saved my life with metastatic colon cancer, they were all developed here. You know, 6 months of a chemotherapy, of being sick every day, has been worth every morning that I see the sun. And it's this research, the investment in NIH, the quality of research, the committed doctors that'll do the research, the committed doctors that'll take care of you when you're sick and you don't feel like communicating with anybody, but yet they're patient with you, they love you, they tender to you, they nurture you. We have a great system there. If you have a cardiovascular event, this is the best place in the world to have one. If you have a heart attack, if you have a stroke, if you get cancer, if you have an acute fracture of a limb or joint degeneration, this is the best place in the world to have any of that. So I've outlined the problems, which are big, and the things that are good. So what do we do with that? Our goal ought to be, do not destroy all these good things while we go to fix the things that are not good. How did we get in trouble? How did we get to where we have the highest percentage of our GDP, this thing that really limits people into care, cost? How did we get to where we are? Why is it? Well, part of it's been innovation. About 30% of the cost increase that we see in our country is because innovation, it takes money to get innovation, and when innovations come out, we have to pay for the research that wasn't paid for up front. And so about 30% of the healthcare inflation we see is from new products, new innovation, new ideas, new treatments, new strategies, or new procedures. But the rest of it goes back to this Thomson Reuters, where we have this inefficient delivery system of healthcare. A question I asked my staff, and we did research, what was healthcare inflation before 1970? Do you realize that most of the time it was less than the regular increase in inflation? What was the difference? What happened? What happened during that period of time? What happened is the government got involved in healthcare. We created demand that was price-controlled demand, and all of a sudden, the bubble started squeezing up. The other point that I would want to make is most people don't realize that 61% of the healthcare in this country today is run through the government. So if we have a problem with healthcare, we got to look at not where the 39% of it is, but where the 61%. And let me explain what that is. That's Medicare, that's TRICARE, that's VA, that's Medicaid, that's Indian Health Service, that's SCHIP, that's DOD, and that's FEHPB. That accounts to 61% of the people in this country that have health care. They're getting it through the government now. And our answer is more government? Our answer to the solution is more government? So what should our goals be? Our goals should be access for everybody. Our goals should be affordable prices. Our goal should be liberty to choose what is best for you and yours, not limited by your state, not limited by your federal government. It should be your choice. Freedom to choose your caregiver. You don't get that in Medicaid. You don't get that at the VA. You don't get that at Indian Health Service. And you limitedly get it through Medicaid. Another goal we should have is security in your health care. Knowing that no matter what happens, you're going to have health care. Those are things I think the presiding officer would agree with. I'm joined on the floor by the other physician in the Senate, Senator Barrasso from Wyoming, and I welcome him And I kind of wanted to just spend one additional second, Senator Barrasso, outlining here is the bill that we have on the floor, the Reid substitute. And I'm not going to talk about the parliamentary shenanigans that have gone along with what we're doing and how this is going to. The fact is we're going to have a debate on health care. I couldn't have been said any better by Senator Snowe. Every major piece of legislation that has affected most people in this country has occurred on a bipartisan basis. If this gets passed, you will see a revolt in this country because it's not what the vast majority across party lines want to see. We need to meet in the middle on it. But just so I can tell you what's in here or what's not in here. There's no provisions in here guaranteeing that taxpayers aren't going to finance abortion. There's no provisions in here prohibiting the rationing of health care. You will see rationing of health care with this bill. We're seeing it now in Medicare more every day. CMS is not supposed to be doing it. They have a reason not to do it. There's a law that says, quote, they're not supposed to do it, but it doesn't absolutely prohibit them, and now they're rationing about 17 things. They've made a decision on practicing medicine. You're going to see that in here. There's zero number of senators that are going to be required to enroll in the health care bill we're going to put everybody else in, the health care plan. There's 9 new taxes created in this bill, 9 new separate taxes. There's 13 pages in the bill's table of contents, single-spaced. This bill weighs 20.8 pounds. It has 36 pages in the CBO explanation of what they think it might or might not do. It has 70 new government programs, 70 new government programs. Think about what that means in terms of bureaucracy, and then think about your choices about who you want taking care of you and whether you and that caretaker, that physician, are going to get to decide what's best for you or some of these 70 new government agencies. 1,697 times in this legislation, we allow the Secretary of Health and Human Services to create, determine, and define critical things in this bill and write the regulations 1,697 times. There's going to be 1,697 new sets of regulations in health care in this bill alone. There's 2,074 pages. There's 2.5 million people who are going to lose their health insurance with this bill that have it today, that are going to get moved into some government program. There's still going to be 24 million people left without health insurance if this is fully implemented, according to CBO. This bill costs $6.8 million a word. $6.8 million a word in this bill. It's $1.2 billion per page is the cost of this bill. $10 billion is going to need every year for the IRS just to follow the regulations for the tax collection in this bill. $10 billion a year. That isn't even considered in the CBO score. There's going to be $8 billion in taxes levied on uninsured individuals. There's going to be at a minimum of $25 billion a year in increased mandates on states for Medicaid. $28 billion in new taxes on employers not providing government-approved plans. $100 billion annual fraud in Medicare. $118 billion cuts to Medicare Advantage. $465 billion total cuts to Medicare. $494 billion in revenue from new taxes fees levied on American families and businesses. $2.5 trillion is the non-Enron accounting cost for this bill. And finally, there's $12 trillion worth of national debt today, and this bill by itself will take it to $15 trillion in 10 years. It'll increase the national debt in less than 10 years by $3 trillion. So with 61% of the health care in this country already supplied by the government, and either bankrupt or going bankrupt, or not giving the care that's promised, look at Native American care, and we're going to do more government health care. You know, Senator McCain had a great analogy the other day on this bill. This bill starts collecting taxes right away. And the American people need to know the reason the delay in the onset of the benefits of this bill is because that's the only way they can make it score and look like it's not spending the amount of money that it's spending. But he used this analogy, and I thought it was really great. This bill's like you buying a new home. And you go get your mortgage, and you start paying on your mortgage, and you get ready to move in the house, and he said, no. The deal was, you can move in 5 years, because that's when the benefits start, in 5 years from now. But we want you to pay on it for 5 years before you get to move into it. None of us would do that. Yet that's exactly what this bill does. It's not a bait and switch. It's just deceptive. And it's dishonest in its accounting. And of course, Washington has been dishonest. We use Enron accounting. Anything that makes it look less expensive or us look better, that's how we account for it. Finally, I'd say this, and then I'll yield to my colleague and fellow physician, Senator Barrasso. Of the things that are wrong with health care in America and the things that are right, the things that are right is because we've got a patient-centered. The things that are wrong are associated with government-centered. This is a government-centered health care fix, and it's not even a fix. It doesn't address malpractice costs. It doesn't, it's somewhere between $100 and $175 billion a year in tests we're ordering that people don't need because we refuse to address the tort system in this bill. What we need is a patient-centered result. And what we need is meeting in the middle to solve this problem for the American people. Abraham Lincoln said, America will never be lost by being destroyed from the outside. If we falter and lose our freedoms, it will be because we've destroyed ourselves. This bill is the path to destruction for health care in America. 80% of the people in this country will get along just fine with this bill. 20% are going to suffer drastically under this bill because it totally ignores the clinical practice of the art of medicine. And everything's based on a government-run, government-mandate, government-controlled fiat that takes away your liberty, takes away your choice, takes away your freedom. And now we will move physicians from being 100% advocate for the patient to an advocate for the government first and the patient second. That's the worst health care outcome we could have. Senator Barrasso.